Hey friends, today I want to talk about the biggest reason valley fever gets missed in dogs. That's because it's a master impersonator. Dogs with valley fever don't walk into an exam room wearing a sign that says fungal infection. Valley fever can look like kennel cough, pneumonia, arthritis, hip dysplasia, IVDD, bone cancer, epilepsy, a brain tumor, lymphoma, a skin infection, or a dog who is just fading and no one knows why. That is why it gets misdiagnosed so often. And this becomes super important for dogs who do not live in classic valley fever areas, but have a travel history to one. So a dog in the Midwest or on the East Coast may have been adopted from the Southwest. They may have gone on a road trip out west. They may have spent the winter in Arizona with their pet parents. And once that dog goes back home, like to the East Coast or the Midwest, and gets sick, nobody thinks to ask, has this dog ever been in valley fever country? That one question changes everything. So valley fever is caused by a fungus called coccidioides. So let's back up a little bit. It lives in the soil and dogs inhale the spores from the dust. But the illness may not show up until later, weeks or even years later, and often somewhere else in the country entirely, meaning the dog developed it on their trip and moved or returned home somewhere else, and they got sick in another location. So I've seen vets refuse to test for valley fever because it's not common here. That doesn't matter if the dog has a travel history. A disease diagnosis is not only based on what state the dog is standing in today. We need to take into account where the dog has been at any point in time. So let's walk through what valley fever commonly mimics. So valley fever typically starts as a respiratory infection. A dog will have a cough, maybe a fever, low energy, poor appetite, and this commonly gets misdiagnosed as kennel cough, and in more severe cases, bacterial pneumonia. Both kennel cough and valley fever can move from a respiratory infection to a pneumonia. So if the dog is diagnosed with kennel cough, the dog may be treated with doxycycline, maybe some prednisone, and valley fever, testing may never be done. Fortunately, vets in endemic states like Arizona more readily test for valley fever when they see a dog come in with these symptoms because they see it so often. And so if that's your dog and they're recommending a valley fever titer, I would do that. I would take their recommendation. And this is the difference experience makes. On a personal note, this is exactly what happened to me in 1982. So I was misdiagnosed in the ER in Arizona, the #1 state for valley fever, with a bacterial pneumonia. I had classic valley fever signs. I know this now. I didn't know it in 1982 because I'd never heard of it. So another common issue is that many x-rays are interpreted by radiologists who work remotely, and that's just a fact of life now. Everything is digital. And if the radiologist, if they don't live in a valley fever endemic state, fungal pneumonia on an x-ray gets missed, and they call it bacterial pneumonia, or they call it aspiration pneumonia, or they don't even mention fungal as a possibility on the report at all. So an x-ray will show a pattern, not an organism. pneumonia on an x-ray does not automatically mean bacterial pneumonia, but it gets missed. Valley fever gets missed that way. Valley fever mimics orthopedic diseases. It loves to mimic joint and bone problems. So a dog may have a limp, a shifting lameness. So a limp that goes from one leg one day to another leg another day. A dog may have joint pain or reluctance to jump. They may look like they have arthritis, or they may get diagnosed with a sprain or a strain or a torn ACL or hip dysplasia. Or my most favorite one is just getting older. I've seen dogs diagnosed with hip dysplasia when the hips look normal on x-rays. I've seen dogs diagnosed with old dog arthritis. So if a dog from valley fever country is limping or has any orthopedic signs, valley fever belongs on the list of possibilities. When I was doing conventional medicine and surgery, before I would take a dog to surgery for an ACL, or before I would send that dog to a orthopedic surgeon for ACL surgery, I would make sure that a valley fever test was done. And that's important because that can be underlying the problem and not the whole problem. So if the dog has some kind of orthopedic problem, but also has a history of a fever, maybe some weight loss, maybe some lab work changes like high globulins or high white blood cells, or even symptoms that suggest valley fever, then valley fever goes on the top of the list for the possibilities of why this dog is having orthopedic problems, and it needs to be tested for. Valley fever can affect the spine, and it looks like, or will be misdiagnosed as IVDD, or intervertebral disc disease. IVDD and valley fever will cause neck and back pain. And when they have valley fever in the spine, it can look exactly like disc disease. And if the dog is diagnosed with disc disease or IVDD, the dog's placed on pain medication, muscle relaxers, anti-inflammatories. They get crate rested. But the treatment for IVD and spinal valley fever are different. There are some similarities, but there are major differences that will make a difference. So missing the diagnosis costs time that the dog doesn't have. And this is actually what happened to Spencer. Spencer is a dog I saw that was told that he had old dog arthritis. And he checked both of these boxes that we just talked about. So his regular vet felt that he had just old dog arthritis. And so they came to me for acupuncture and chiropractic for arthritis treatment. And I also do cold laser therapy and other things. And when I saw him, he looked like he had IVDD of the neck. He was all scrunched up and he was limping on one leg, which is a classic sign of a disc prolapse in the neck. He's actually in my book. Let me pop that up here. Let's see. Here's a QR code for my book. It's called Conquering Valley Fever, a tactical guide for dogs and their humans. And Spencer is in there. And I talk about his case and what happened with him. So it was pretty amazing. And in my book, I go over conventional therapy and holistic therapy. and all the things that you can do for your dog if you think they have valley fever, or they've been diagnosed with early valley fever, or they've had valley fever for a long time. And there's also people stuff in there because I've had valley fever twice. It's lovely. Kid, just kidding. Okay, so another thing that commonly valley fever will mimic is bone cancer. So valley fever in the bone creates really destructive lesions, and they look just like osteosarcoma or bone cancer on an x-ray. And I've seen dogs that were referred to the oncologist, or the conversation moves right to bone biopsy or amputation without ever testing for valley fever. A valley fever test is a blood test. It's non-invasive. And this is actually what happened to another one of my dogs in the book, Maya, who was diagnosed by a board-certified radiologist and the regular vet and another vet specialist with osteosarcoma or bone cancer, when it ended up being valley fever. Unfortunately, we figured that out. I kind of ruined that one for you, but but there's more about her case in my book. So that's Maya. That was a crazy case. But valley fever is misdiagnosed all the time. The other thing that I see valley fever mimicking is neurologic diseases. So valley fever can cause brain inflammation or granulomas, and granulomas is like scar tissue surrounding the fungal spores or the fungal infection. The body walls them off and forms these little scar tissues, and that'll happen both in the lungs but also in the brain. And if it happens in the brain, it looks just like a brain tumor or brain tumors on an MRI. So valley fever in the brain can trigger seizures. It can cause a head tilt or circling or loss of balance. And so new seizures in a dog, or a dog that has old dog vestibular signs, which is the eyes that wobble and the head tilt and the balance problem, sometimes they roll, they deserve a second look, and they deserve a blood test for valley fever. If they are in a valley fever location, or if they have visited or just traveled through the Western United States, valley fever needs to be tested for. The other thing that valley fever can mimic is another cancer, lymphoma, because it causes big lymph nodes. And the lymph nodes may be big just like under the neck or chin, or they can be big all over the body. But big lymph nodes often trigger that knee-jerk reaction of lymphoma. But infections like valley fever, or even tick-borne diseases like tick fever, will all cause big lymph nodes. And the treatments are completely different for each one of these. So determining the exact cause of why the lymph nodes are big is crucial. And that can be done with blood testing, maybe a biopsy of the lymph node, or a fine needle aspirate of a lymph node. The other thing that is commonly missed, and this is a weird one, is skin diseases. So valley fever mimics a lot of other skin diseases. So it'll cause these non-healing sores. It can cause rashes. It can cause abscesses. It can cause draining wounds. And they're commonly written off as like bite wounds or foreign bodies, like a foxtail that's stuck in there somewhere, and they go looking for it. Or bacterial infections, or like yeast infections on the skin if it's a rash. And they're treated with antibiotics a lot of times. And sometimes they're treated over and over with antibiotics. This might be TMI, but I have disseminated valley fever. And this little doodah here is one of my valley fever lesions that I have right now. So my valley fever is in remission, but I still get these valley fever sores. So I get these skin sores from valley fever. So it's freaking weird. And so interestingly enough, I went to a dermatologist years ago for these. And they're like, yeah, some people are just prone to those. And I'm like, well, what are they? And they just gave me like an antifungal cream or a shampoo and didn't say anything. And I'm like, well, now I know. Thanks for letting me figure it out myself that these are valley fever lesions on my skin, which is not infectious. Okay, so moving right along. So sometimes when a dog has, these draining tracts, they'll get oozy lesions on the skin. It'll mean that the bone beneath that skin is infected. And so the skin is just the tip of the iceberg. And so that's actually how I got valley fever the second time, is from my dog Katie had a bone lesion, and it started, it broke through the skin and started draining to the outside. And so when that happens, the fluid that drains to the outside can grow fungal spores, and those are infectious to everybody, all mammals, humans and pets and animals. So draining bone lesions are zoonotic, and they need to be taken seriously. Not fun. So eye diseases is another thing that valley fever mimics. So valley fever can cause uveitis, which is inflammation inside the eye. And it's often mistaken for things like glaucoma or autoimmune uveitis or autoimmune inflammation of the eye. It's misdiagnosed as cancer in the eye or trauma to the eye. But if the dog lives in or has visited a valley fever endemic area, valley fever needs to be considered on the list of possibilities for that inflammation in the eye. Another thing that valley fever mimics is heart disease. And this actually happened to one of my other dogs. So Katie with the bone lesion that had the draining tract on the skin that gave me valley fever, also gave valley fever to 4 of my other dogs. And one of the other dogs, Griffin, who Katie and Griffin are in my book too, by the way, their stories, but I'll tell you part of it. Griffin likely developed heart disease from his form of valley fever, because Katie gave valley fever to 4 out of 5 of my other dogs. One did not get it. Actually, the oldest dog did not get it at all, but the other 4 did. And Griffin, they all were being treated. They all were under treatment. And Griffin, and this happens typically with heart diseases, Griffin, the fever went away. He started eating again. He was doing great. Everything was fine. And then the next day he died in his sleep. And this is less common, but it's serious, because valley fever in the heart is usually fatal. And so a lot of times, even before we diagnose it, it's fatal. A lot of these dogs are diagnosed with valley fever after they've died, which is really sad. So valley fever of the heart usually results in acute death. But valley fever can cause myocarditis, which is inflammation of the heart muscle, and it can cause arrhythmias, which are an abnormal heart rhythm. Or valley fever can cause fluid around the heart. It's called pericardial effusion. It's when there's a pericardial sac, which is a really thin layer of tissue around the heart that protects it. And inside that sac, fluid can form when they have valley fever, and other things can cause that too, but valley fever can cause that. And as more fluid forms in this sac around the heart, it squeezes the heart and the heart stops. Not a pretty thing. I actually consulted with a pet parent last year, I think it was November, with a dog that was in the ER and they wanted to take it home. They were like, we want to get this dog out of here. And the ER vets had suspected valley fever myocarditis because the dog was positive for valley fever, had been positive for valley fever for a long time, and they could not get the titers down. And it presented at the ER with tachyarrhythmia, which is a really fast, irregular heart rate or heartbeat. And they could not get this under control. They had him on all the IV heart medications and drugs, and they could not get his heart under control. He wasn't responding to anything. And they gave him 10 days to live. And the pet parent took him home against medical advice. And he's alive today. So he actually survived. And he's the only dog I know that has survived with valley fever myocarditis. At least that's what we're all suspecting, is valley fever myocarditis that led to a tachyarrhythmia that was going to be fatal. So he survived with a change in the antifungal drug. So we pivoted with the pharmaceutical. And then I also added a whole bunch of holistic support, herbs and supplements and other things. So he's the only case that I've personally seen pull through with a heart problem related to valley fever. So in valley fever country, a heart arrhythmia or pericardial effusion should make us think of valley fever. So we need to test for it so we can help prevent them from dying, like Starkey. And Starkey's still alive today. But not Griffin. Poor Griffin. So valley fever can also cause liver and kidney disease. So valley fever can cause an elevation in liver enzymes, an elevation in kidney values, and it will mimic kidney failure or liver failure or hepatitis. And so when I see abnormal liver or kidney values in a sick dog that lives in valley fever country or has visited valley fever country, I ask what else is going on. So do we have a history of coughing or limping or weight loss or a history of a fever? Is there high globulins on the blood work? Have there been swollen lymph nodes, or is there swollen lymph nodes now? The liver or kidneys may be involved, but they may not be the root cause. So valley fever may be the root cause of why this is happening. And it can happen for several reasons with valley fever. So the other thing that I see with that valley fever mimics is reproductive diseases. And this is a weird one because most dogs are spayed and neutered. So we don't really get into a lot of repro diseases, but I've seen this a few times. So valley fever can cause swollen, painful testicles in an intact male dog, obviously. And this is a symptom of disseminated valley fever, where the valley fever starts in the lungs, but has left the lungs and gone somewhere else. And it can go to testicles. Go figure. And that gets misdiagnosed as trauma or a local infection, even brucellosis. But we need to test for valley fever with these guys. The other thing valley fever mimics is a fever of unknown origin, or FUO. So a persistent or an intermittent fever with no clear cause. So if you haven't, or if a vet hasn't tested for valley fever and is causing a fever as an unknown origin, it may not be. It may be valley fever, especially if they've lived in or traveled to the Western United States. So we need to do valley fever testing. Full stop. Valley fever mimics other kinds of cancer. So we talked about bone cancer, we talked about lymphoma, but there are other things, other kinds of cancers that valley fever will look like. So lung masses, valley fever granulomas look just like lung tumors, and that gets misdiagnosed in people a lot and pets a lot. Skin masses can look like cancer, but they can be valley fever granulomas on the skin. And we only find out if we test or if we treat. So one of the tip-offs with Maya in my book, the one that was misdiagnosed with bone cancer, was that she had these weird skin masses, but they went away when we started valley fever treatment. So all those skin masses weren't little tumors, or actually they were pretty big. They're like golf ball size, but they went away with valley fever treatment. So those were also part of her valley fever infection. So she got misdiagnosed by her vet and the radiologist and another vet specialist, because they sent her for an oncology referral because of the osteosarcoma, because they didn't think valley fever was endemic in the state they were in. And so they didn't test for it. And it was endemic in that state that they were in. So valley fever also mimics tick-borne diseases and autoimmune diseases. And these symptoms all overlap. So tick-borne, valley fever, autoimmune can all kind of overlap. They all can cause fever, joint pain, swollen lymph nodes, and abnormal blood work, and more. And valley fever and the tick-borne diseases can actually induce an autoimmune disease, which kind of complicates the diagnosis. And I've also seen valley fever and tick fever in the same dog several times. So you can actually have all of these in one dog. So testing is super important so that the dog gets proper treatment. So we need to figure out what it is, or what things it is. It may be more than one thing, and we need to know all of those things so we can treat the dog appropriately. So valley fever also masquerades as just an old dog that's tired and not eating and losing weight and slower on walks and trouble getting up. And vets will blame the symptoms on age and arthritis and maybe kidney problems without testing for valley fever. Old dogs get valley fever too. And it hides under what looks like normal aging. And that's what happened to Spencer in my book. He was diagnosed with old dog arthritis when it really was valley fever. And when we actually treated his valley fever, he got remarkably better. And he just had his 17th birthday. Still going strong. And he doesn't have old dog arthritis. So why does this keep happening? So most vets outside endemic areas, so outside areas that have valley fever, don't think about it because they've never seen it. Plus, it's never taught in vet school. And if it is, it's just briefly mentioned in passing, and it's lumped together with all the other systemic fungal infections out there. Another reason this keeps happening is that veterinary radiologists or board certified radiologists, veterinarians that are working remotely in non-endemic states like the East Coast, which is pretty common, will miss it. So when they interpret x-rays from dogs in the Western United States, and they're in the Eastern United States, they don't even think about fungal infections. And so it's not even on their list of possibilities in the report. And then the regular vet considers this board certified radiologist report the freaking gospel, when they should be using common sense and questioning the interpretation. And I actually see this a lot in my telehealth consultations. that it's missed by a specialist, and the regular vet doesn't question the specialist, and they'll call it something else. They'll call it like bacterial pneumonia or aspiration pneumonia if it's in the lungs, or they'll call it osteosarcoma if it's in the bone, or they'll call it lung cancer if it's granulomas in the lung. Like, it's missed all the time. So we need to question that, right? So pet parents may not realize that, if they travel with their dog, that's an important part of the dog's history, and your vet should know about it. And the other reason things get missed are that valley fever symptoms are vague, and it's just not one set of symptoms. It can be anything, and it presents differently in every pet and in every person. There isn't like this common valley fever disease. It's so bizarre that it could be very mild and vague, or it could mimic anything else. So it can be tough to diagnose, and that's why it gets missed. So we have to consider where the dog lives, where they traveled to, plus the symptoms, plus the blood work, plus maybe the imaging like x-rays, plus maybe how they responded to whatever treatment they got. If they were treated with antibiotics and they didn't respond, that's important information. So what do? You tell your vet everywhere your dog has lived or traveled, even briefly. So if you're suspecting valley fever, if you've learned about it and heard about it, you can ask your vet, could this be valley fever? Should we run a valley fever titer? And if you're told, it's not common in our area, which happens, it's okay to say, I understand, but my dog has been exposed where valley fever is common. So can we test anyway? Because it doesn't matter where your vet clinic is. What matters is where your dog could have inhaled the valley fever spores, or where they were potentially exposed. So one caveat is testing isn't perfect, and a titer can come back negative even with an active infection. So a negative result doesn't always end the conversation if the rest of the picture points to valley fever. So sometimes we need to do other things. And we went over that last week in the valley fever titer conundrum video. But one of the biggest mistakes a vet can make is never considering valley fever at all. Because once it's on their list of possible diagnoses for a sick dog, they can test, they can monitor, they can interpret everything else with valley fever in mind, and they can avoid wasting months chasing the wrong diagnosis or the wrong disease, while treatment that could have helped the dog gets delayed. And delayed diagnosis and delayed treatment results in a poor prognosis for recovery in both pets and people. And that's actually been researched in people, and that has been proven that your prognosis for recovery hinges on a prompt diagnosis and prompt treatment. It's important, really is. So valley fever can spread to the bone, the joints, or even bones. They can spread to multiple bones on the same dog. I have seen that. Spine, brain, eyes, skin, lymph nodes, heart, liver, kidneys, anywhere. And it can look like tons of other common diseases. So if your dog has lived in or traveled through the Western United States, especially the Southwest, and is showing any unexplained symptom, cough, limp, fever, seizure, eye inflammation, non-healing wound, valley fever needs to be on your vet's differential diagnosis list or a list of possible illnesses your dog may have. Because valley fever doesn't always look like classic valley fever. There's really not a classic valley fever. Sometimes it looks like everything else. And that's exactly why we have to be on the lookout for it. Okay, so thank you for being here with me. Valley fever is a weird one, and that's why I talk about it a lot, because I have been touched by valley fever, and a lot of my dogs have been, and I've treated and seen a lot of dogs with valley fever, and cats and people, but I only treat the cats and dogs. I've actually suspected it in a couple horses. It happens a lot in alpacas and llamas. There's actually research on that. So it's a crazy disease. So we're going to talk about another valley fever conundrum next week, because there's a lot to talk about with valley fever. And this will help you kind of figure out, if you're suspecting it in your dog, or if your dog has it. We'll talk about what to do about it too. All right. So thanks for being with me, and have a wonderful day.